Bismillahirrahmanirrahim. Assalamu alaikum everyone and welcome back to Inside Pharmacy Life. Today we are going to explore something many people struggle with in the pharmacy, choosing the right OTC products for common cold and allergic rhinitis. Let's break it down together. Have you ever stood in front of shelves full of syrups and tablets thinking which one should I take? You're not alone. Today, as your pharmacist, I will share practical guidance on what to use, how to choose, and when to be careful. Let's start with the common cold. Remember, it's usually viral, so antibiotics won't help. Instead, our goal is to relieve symptoms and feel comfortable while the body heals. For a blocked and stuffy nose, we can use decongestants. Oral tablets like pseudoephedrine or phenylephrine help shrink swollen nasal passages. Nasal sprays such as xylometazoline and oxymetazoline give you quick relief too. But very important, avoid nasal sprays beyond 3 to 5 days to prevent rebound congestion, and don't use oral decongestants if you have high blood pressure or heart problems. If you are experiencing headache, body aches or fever, you can use paracetamol or ibuprofen. These medicines make you feel more comfortable as your body fights off the virus. Antihistamines for cold. Sometimes cold brings runny nose and sneezing. First generation antihistamines like chlorpheniramine can help but cause drowsiness, which can actually be useful at night. Second generation antihistamines like cetirizine, loratadine, and fexofenadine are better for daytime because they won't make you sleepy. Soothing agents. Simple soothing agents also help. Honey, menthol, or lemon lozenges can calm your sore throat and reduce irritation. Now let's talk about allergic rhinitis. Typical symptoms include sneezing, itchy nose, runny nose, and watery eyes. Our aim is to control these allergic reactions and improve comfort. Non-sedative antihistamines like loratadine, cetirizine, fexofenadine are perfect for daytime. They reduce sneezing and runny nose without making you drowsy. Sedative antihistamines like chlorpheniramine can be useful at night if your allergy keeps you awake. Nasal sprays and eye drops. Other helpful products include sodium chromoglycate nasal sprays, which prevent allergic symptoms if used regularly, and saline sprays to wash away allergens. If your eyes are itchy or watery, antihistamine eye drops can bring quick relief. So here are some brands of nasal sprays and drops. Zynosine nasal spray, Zynosine nasal drops. It contains the generic xylometazoline hydrochloride and it is of the brand of pharmaceutical company Zafa. Next one is the oxychrome nasal spray. It has the generic sodium chromoglycate and xylometazoline hydrochloride and it is the brand of Sante Private Limited Company. Next one is the oxychrome P nasal sprays. It contains active ingredient or generic sodium chromoglycate and it is the brand of Sante Private Limited Pharmaceutical Company. Next one is the Rhinosone P nasal spray. It contains 3 active ingredients: nafazoline nitrate, ephedrine hydrochloride, prednisolone acetate, and it is the brand of Shazo. These 4 nasal sprays and drops are easily available in any pharmacy. At any pharmacy you can get these brands very easily. These are some saline nasal sprays and drops containing 0.9% sodium chloride, which is also called as normal saline. So the brand is the Norsaline P nasal spray and it also has Norsaline P nasal drops containing sodium chloride USP 0.9% weight by volume, and it is a brand of Atco pharmaceutical company. Next one is the Salinase nasal drops containing 0.9% sodium chloride and it is the brand of Xenon Pharmaceuticals. Next one is the Zynosine saline nasal spray and it is the brand of Zafa. It also has generic normal saline. These are decongestant inhalers, Madix inhaler and Lincus Herbion Lincus inhaler. So how will you counsel the patient about the use of nasal decongestant drops? So first of all, you will tell them to blow nose, squeeze rubber bulb on dropper and withdraw medication from bottle, recline on bed and hang head over side. This is the preferred position, or otherwise simply tilt head back while standing or sitting. Place drops into each nostril and gently tilt head from side to side to distribute drug. Keep head tilted back for several minutes after instilling. Rinse dropper with hot water. And here are the counseling information for nasal decongestant sprays. You will counsel the patient that blow nose, then remove cap from spray container. For best results, do not shake, squeeze bottle. Administer one spray with head in upright position. Sniff deeply while squeezing bottle. Wait 3 to 5 minutes, then blow nose. Administer another spray if necessary. Rinse spray tip with hot water, taking care not to allow water to enter bottle, and then replace the cap. And here is the patient counseling information for nasal decongestant inhalers. I have previously mentioned Medix inhaler and Herbion Lincus inhaler. So you will tell the patient to blow nose first, then warm inhaler in hand to increase volatility of medication. Remove protective cap. Inhale medicated vapor in one nostril while closing of other nostril. Repeat in other nostril. Wipe inhaler clean after each use. Replace cap immediately. And the point to notice that inhaler loses its potency after 2 to 3 months, even though aroma may linger. So discard it after 2 to 3 months. Here are some combination products you can use for cold and allergic rhinitis. And the first one is the Irinic tablet. It contains ibuprofen and pseudoephedrine hydrochloride in combination of 200 mg and 330 mg. It is a brand of Abbott Pharmaceuticals, and it also have the brand of Irinic 4 tablet containing double strength of Irinic 400 mg and 60 mg. Also have Irinic syrup containing 100 mg ibuprofen and 15 mg pseudoephedrine hydrochloride. Next brand is the Provas EZ containing paracetamol, diphenhydramine and phenylephrine in combination. So it is a combination of analgesic, antihistamine and pseudoephedrine. And if you are prescribing Irinic 4 tablet to your patient, you should have add antihistamine with it, because it only contains analgesic and analgesic and decongestant. So you should have to add antihistamine with Irinic 4. But with Provas EZ, it is the combination of three ingredients: paracetamol, diphenhydramine and phenylephrine. Next one is the Fixit D brand of Getz Pharmaceuticals, and it contains fixofenadine and pseudoephedrine. So it is the combination of antihistamine and decongestant, so you should have to add an analgesic with this product. Next one is the Panadol CF Day tablet. Panadol CF Day tablet contains paracetamol and phenylephrine, and Panadol CF Night contains paracetamol, pseudoephedrine hydrochloride and chlorpheniramine maleate. Again, it also contains analgesic, decongestant and antihistamine. Reltus CF tablet also contains paracetamol, pseudoephedrine hydrochloride and chlorpheniramine maleate, and Reltus CF syrup also. This is the brand of Formatec company. Next, here are some brands of antihistamine. Sedative one contains chlorpheniramine, and the brand name of chlorpheniramine is Piriton, and it is the brand of GSK company, GlaxoSmithKline. Next one is the non-sedative antihistamine, second generation. So cetirizine tablet and syrup. Brand name is Rigix, company name AGP, brand name Zyrtec, company name GSK, and brand name Sedil, company name cetirizine. Loratadine tablet and syrup. Loratadine brand name is Antiol, company Sami, Jordan, Haiku, Soften, Varic. Next is the fixofenadine tablet. It is available in 3 strengths: 60 mg, 120 mg and 180 mg. Brand name is Fixit of Getz company, Telfast of Sanofi Aventis and Fexofen of Horizon. These are some commonly available brands. Otherwise, there are lots of brands available in the pharmacy. I have mentioned the commonly available brands which you can get from any pharmacy. Thank you for watching Inside Pharmacy Live. please like, subscribe and share this video so more people can make safe choices. And tell us in the comments which OTC products do you always keep at home. And the assignment question is you have to tell me the pharmacological class of pseudoephedrine, phenylephrine, xylometazoline and oxymetazoline, and why these agents should be avoided in hypertension. See you next time. Khuda Hafiz.